Good evening, you're tuning in to AWANI Tonight with me, Faye Kwan. The government has been urged to abolish all forms of corporal punishment as it violates fundamental human rights and dignity. In a statement today, the Human Rights Commission of Malaysia, or Suhakam, says it is deeply concerned over the recent death of an inmate at Pokok Sena prison allegedly due to whipping.
The Commission urged authorities to conduct a full, independent and transparent investigation into the circumstances around the inmate's death. Suhakam said the physical and psychological harm caused by corporate punishment contradicted international human rights standards, equating it to torture under the UN Convention Against Torture, which Malaysia has yet to ratify. It also stressed the importance of reforming the country's criminal justice system, shifting towards rehabilitative approaches.
Putrajaya is closely monitoring government-linked companies, GLCs, and government-linked investment companies, GLICs, to prevent any misconduct. Prime Minister Datuk Seri Anwar Ibrahim says this is based on the Auditor General's previous announcement that her office will audit 2,000 GLCs from next year to ensure greater accountability.
Dan kita juga telah bersetuju supaya Ketua Audit Negara mengaudit semua 2,000 ini. Saya ingat akan satu jadi kejutan supaya semuanya akan lebih bertanggungjawab. Kerana kadang-kadang pelanggaran itu masih berterusan di beberapa peringkat dan tidak ada jalan lain tetapi untuk kita jalankan audit dan memantau terus. Terima kasih.
Meanwhile, he said those being considered for board positions in GLCs and GLICs will also go through strict checks by security and financial agencies. He said this is to ensure that the individuals selected have clean records and can withstand scrutiny. Anwar, however, said while professionals are preferred for these roles, there is no discrimination against politicians to be appointed if they meet the qualifications.
Fee collection from the implementation of the Vehicle Entry Permit (VEP) is expected to surpass 100 million ringgit in 2024. Transport Minister Anthony Loke says talks will be held with the Finance Ministry on ways to improve public transportation in Johor with the revenue generated.
He said collection from the VEP in 2023 was more than 90 million ringgit. He added that with the expected increase in vehicles from Singapore entering Johor, the collection fee is estimated to cross 100 million ringgit this year. For every 20 ringgit of revenue collected for VEP, 5 ringgit is given to the Johor government. The revenue can be used to increase public bus routes in Johor following the completion of the Rapid Transit System or RTS link connecting Johor Bahru and Singapore. The RTS is 83% complete as of July 2024 and is on track to start operations on 1st January 2027. According to Loke, the ministry collected road charges totaling 87,944,580 as of September this year. On average, 16,107 vehicles enter Johor from Singapore daily.
The National Fraud Portal, NFP, has slashed the time needed to trace funds by 75%, bringing it down to just 30 minutes, according to Deputy Finance Minister Lim Hui Ying. She adds that since the NFP's launch in April 2024, frozen funds have increased by 28%.
Hui Ying said financial institutions' ability to detect mule accounts has also improved by 14% since the NFP's implementation. The control measures introduced in September 2022 have led to financial institutions blocking unauthorized and suspicious transactions worth 383 million ringgit in 2023. According to her, the trend of phishing and malware fraud cases reported to the NSRC has also shown a decline. She urged victims to report the crime as soon as possible by contacting the NSRC at 997 so that financial institutions can take swift action.
The House Arrest Act bill is expected to be tabled in Parliament in the middle of next year. Prisons Department Director General Datuk Nordin Mohamad says the first draft was completed in June and has been sent to the Home Ministry for further review.
The draft of the bill was submitted to the Ministry's division in charge of prison anti-drug matters and the People's Volunteer Corps. It will be handed over to the Attorney General's chambers once completed. During the tabling of Budget 2025 last week, Prime Minister Datuk Sri Anwar Ibrahim announced that the government would introduce a new law to allow house arrest as an alternative punishment. Offenders could be detained in designated facilities such as their homes, care centres or workers' dormitories while serving their sentences.
AWANI International is your gateway to global news, insights and stories that matter. From breaking headlines to in-depth analysis, stay connected with the world right here where you won't miss a beat.
Rambut gugur lagi? Macam mana Gunakan Pantene Baharu dengan provitamin mikro yang meresap dan menguatkan rambut dari dalam. Rambut 10 kali lebih kuat terhadap rambut gugur. Pantene Baharu.
Penstreaman ataupun muat turun kandungan haram seperti penggunaan kotak TV Android adalah aktiviti yang sangat berisiko dan boleh mendedahkan anda kepada malware, virus, ransom dan juga penipuan seperti scam dan juga judi atas talian. Elakkan daripada stream atau download haram. Ingat, layan ori, jangan curi.
The government announced 25 million ringgit for the launch of Rakan KKM under Budget 2025. The public-private partnership program aims to provide Malaysians with affordable access to the best healthcare available. Professor Datuk Dr. Syed Muhammad Al-Junid from IMU University highlights some of the concerns under the scheme and ways to ensure equity in healthcare.
Their concern is that whether patients who are not in the Rakan KKM system will be able to provide or way to assess same quality of services, and their services, their quality is not compromised by the specialists or by the healthcare personnel who are actually treating the patient under the Rakan KKM scheme. So this is the concern. We really have to make sure that, for example, in terms of the quality, the waiting time for non-Rakan KKM patients would not be actually longer or would not be worse off than those who are under the Rakan KKM. This is something that we need to ensure that it does not happen. I'm sure we need a very strong, we need to have a very strong monitoring mechanism to put in place.
Therefore, he called for capping of the amount of reimbursement that doctors and specialists can obtain from the Rakan KKM scheme.
This is done in other countries. For example, in Singapore, they have almost a similar scheme that, but the maximum that anybody who are involved in this program is probably 2 or 3 times than their basic salary. Once they receive or they achieve that level, they were whatever that the services that they give, they will not be able to claim anymore, but it goes back to the pool. So in other words, this will discourage them to put too much attention or to actually entice them away from the non-Rakan KKM patient and provide equal services to those who are actually unable to embark on the Rakan KKM because they may not have the ability to pay for the services. So that is capping is very important. But how do we do that? In order to do that, we must have data and we must have a strong monitoring body. This is very important. This monitoring body should be independent. And if we actually build this monitoring mechanism within the system itself, there will be a lot of conflict of interest. Maybe if we ask if they headed by head of the department, for example, but the head of the department might also be involved in the scheme. So there is very little incentive for them to regulate the system. So monitoring mechanism is very important. And I would suggest that the government should think about having an oversight body, which representative from patients, from NGOs, to actually monitor the implementation of this program and take affirmative action whenever the program has been deviated from its actually a real objective.
Israel has declared a state of emergency after Hezbollah fighters from Lebanon launched medium-range rockets towards Tel Aviv. The group claims to have targeted an intelligence office in Tel Aviv and a naval base in Haifa. No casualties have been reported so far. Meanwhile, in Lebanon, 4 people, including a child, were killed in an Israeli airstrike on Monday evening near the main government hospital in southern Beirut. Israel says it was attacking facilities linked to Hezbollah. This escalation between the Israeli military and Hezbollah comes as U.S. Secretary of State Anthony Blinken arrives in Israel for talks with officials. He is set to meet with Israeli Prime Minister Benjamin Netanyahu, though expectations for diplomatic progress remain low. In Gaza, Israeli drone strikes on the northern city of Beit Lahia have killed at least 15 people, including women and children. Since Israel intensified its offensive on Saturday, more than 80 people have died, with residential areas in the north being heavily targeted. Hospitals and evacuation centers are reportedly under siege, with reports of Israel ordering civilians to head to military checkpoints for evacuation. Israeli officials said evacuation orders were aimed at separating Hamas fighters from civilians and denied there was any systemic plan to clear out civilians. Junior doctors in India's eastern city of Kolkata called off a 17-day-old hunger strike in protest against the rape and murder of a trainee doctor. The move came following a meeting with West Bengal Chief Minister Mamata Banerjee to hear their demands on Monday. The junior doctors said the minister agreed to some of their demands, but that the overall meeting was not positive, vowing that they will continue to fight for justice and safety at medical colleges and hospitals. The junior doctors, however, said they did not withdraw from the strike because of Monday's meeting, but due to requests from the people and parents of the trainee doctor. They also announced to withdraw the proposed complete strike by all doctors, including senior medical practitioners, scheduled for Tuesday. On August 9th, a 31-year-old female trainee doctor at R.G. Kar Medical College and Hospital in Kolkata, India, was raped and murdered in a college building. Her body was then found in a seminar room on campus. A police volunteer was arrested for the crime, which sparked nationwide protests in August and September. Former One Direction singer Liam Payne had multiple drugs in his system when he fell to his death from a hotel balcony in Argentina. Sources told ABC News that among the substances include a cocktail of drugs called pink cocaine. According to the preliminary toxicology report, the cocktail contained methamphetamine, ketamine and MDMA. The report identified other drugs such as cocaine, benzodiazepine and crack as well, though the results of the toxicology tests are preliminary and a full analysis is still pending. The 31-year-old British singer died last week after plunging from a third floor of the Casa Sur hotel room in Palermo. A preliminary autopsy report from the Argentinian Public Prosecutor's Office revealed that Payne died of multiple traumas and internal and external bleeding. The report stated that the head injuries were sufficient to cause death and that no one else was with him at the time of his death. Authorities think he may have fallen from the balcony in a state of semi or total unconsciousness. Investigators are also trying to figure out who sold Payne the drugs he took, with statements from at least 3 hotel employees. That wraps up this edition of AWANI Tonight. Before we end, a reminder that AWANI International is now live on Astro AWANI's web portal. Astro AWANI's revamped English platform delivers in-depth global news and expert analysis to keep you informed on the critical events shaping our world, all in one place at international.astroawani.com. That's all for now. I'm Faye Kwan. Thank you for watching and good night.